Good morning, everyone. Welcome to today's presentation. I'm excited to be here with you. Today, we'll be discussing duloxetine. This is the first slide, so we'll start with an overview. We'll cover what duloxetine is, how it works, and its clinical uses. I look forward to sharing valuable information with you. Let's get started. Let's take a look at clinical scenario 1, which I like to call the drained mind. We have a 35-year-old woman who is dealing with major depressive disorder. Now, she previously took an SSRI, but she experienced some unwanted side effects like sluggishness and weight gain. These are common issues that can make patients feel worse rather than better. So, to improve her energy levels and emotional state, her doctor decided to switch her to duloxetine. The goal here was to find a medication that not only helps with her depression, but also boosts her energy and lifts her overall mood. This scenario highlights an important concept. When managing depression, it's crucial to consider how side effects impact the patient's quality of life. Sometimes, adjusting medication can make a significant difference in how they feel and function day to day. And of course, this ties into our broader theme today: personalized treatment and the importance of tailoring therapy to meet each patient's unique needs and responses. Let's look at clinical scenario 2, which is about the burning feet. We have a 58-year-old man who has had diabetes for a long time. He reports experiencing a burning pain in both of his feet, and noticed that this pain tends to get worse at night. This is a common symptom in diabetic neuropathy, where nerve damage causes abnormal sensations like burning or tingling. The physician has prescribed duloxetine, which is used not only to help with mood, but also to manage neuropathic pain. Duloxetine works by acting on central pathways in the nervous system, helping to modulate pain signals. This case highlights how managing neuropathic pain involves targeting the nervous system itself, and medications like duloxetine can be effective in alleviating symptoms that significantly impact quality of life. It ties into our overall theme of understanding different approaches to treat nerve-related pain in diabetic patients. Let's look at clinical scenario 3, which focuses on managing pain without opioids. Here, we have a middle-aged woman dealing with chronic back pain along with anxiety. What's important to note is that she refuses to take opioids, which is a common concern given the potential risks associated with their use. Instead, we opt for duloxetine, a medication that can help address both her physical pain and her psychological distress. This highlights the importance of considering alternative therapies that can target multiple aspects of a patient's condition, especially when they have reservations about opioids. Overall, this scenario underscores the value of personalized treatment plans that respect patient preferences while effectively managing pain. Let's take a closer look at the mechanism of action of this medication. It's classified as a serotonin norepinephrine reuptake inhibitor, or SNRI for short. What this means is that it works by blocking the reuptake of two key neurotransmitters, serotonin and norepinephrine. By preventing their reabsorption into nerve cells, it effectively increases their levels in the central nervous system. This dual enhancement plays a crucial role because it helps improve mood, which is often a primary goal in treating depression. Additionally, it aids in controlling anxiety, which can be a significant component for many patients. Another important aspect is pain perception. By boosting these neurotransmitters, the medication can also help reduce certain types of pain. So, in summary, the SNRI's ability to simultaneously increase serotonin and norepinephrine levels offers a comprehensive approach, addressing mood, anxiety, and pain, all of which are interconnected in many mental health conditions. This interconnected mechanism underscores the overall effectiveness of these medications in managing complex symptoms. In this slide, I want to highlight some of the key clinical indications for the treatment we're discussing today. First, we have major depressive disorder, or MDD, which is a common and often debilitating mental health condition characterized by persistent feelings of sadness, loss of interest, and a range of emotional and physical problems. Then we see generalized anxiety disorder, or GAD, which involves excessive, uncontrollable worry about everyday things, often accompanied by physical symptoms like restlessness or fatigue. Moving on, we have diabetic peripheral neuropathy, a complication of diabetes that causes nerve damage, leading to pain, numbness, or tingling in the extremities. This condition can significantly impact a patient's quality of life. Next, fibromyalgia is listed, which is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, and often sleep disturbances. It can be quite challenging to manage due to its complex and multifaceted nature. Finally, we have chronic musculoskeletal pain, a broad category that includes persistent pain in muscles, bones, or joints, often related to injuries, degenerative conditions, or other underlying issues. These indications are important because they demonstrate the wide range of conditions where this treatment can be beneficial. As we move forward, keep in mind how these diverse clinical indications tie into the overall theme of expanding therapeutic options for complex and often chronic conditions. Let's talk about some of the adverse effects associated with this medication. The most common one you'll encounter is nausea, which many patients report. It can be quite bothersome, but is usually manageable. Other side effects include dry mouth and constipation, which can affect comfort and hydration levels. Some people might experience sleep disturbances, like insomnia or feeling very sleepy during the day, known as somnolence. Additionally, there's a possibility of increased blood pressure, so monitoring is important if you have hypertension or are at risk. While rare, we also need to be aware of the potential for hepatotoxicity, which means liver damage. Overall, understanding these side effects helps us weigh the benefits and risks when considering treatment options. Now, let's talk about some important contraindications and cautions to keep in mind. First, severe hepatic impairment is a major concern. If a patient has significant liver problems, this medication might not be suitable because the liver is essential for metabolizing it properly. Next, we need to be cautious with patients who are on concurrent MAOI therapy. Combining these can increase the risk of serotonin syndrome, which is a potentially serious condition. So, it's critical to review a patient's medication history carefully. We also have to be cautious in patients with uncontrolled hypertension. Since some medications can affect blood pressure, monitoring is essential to avoid any adverse effects. Lastly, for patients who are at risk, such as those with pre-existing liver issues, it's important to monitor liver function regularly to catch any problems early. All these points tie back to our overall goal of ensuring safe and effective treatment by being vigilant about patient-specific factors. Let's talk about some clinical pearls that are particularly important when considering this medication. First, it offers a dual benefit. Not only does it help with depression, but it also provides analgesic effects. This makes it especially useful for patients dealing with both mood and pain issues. Next, it's crucial to taper the medication gradually. Sudden discontinuation can lead to withdrawal symptoms, so a slow taper helps prevent that and ensures patient safety. Finally, for patients with a history of alcohol use or existing liver disease, it's important to check liver enzymes regularly. This way, we can monitor for any potential liver-related side effects and intervene early if needed. These points really highlight the importance of a careful, personalized approach to prescribing and managing this medication, keeping the patient's overall health and safety at the forefront. Let's explore a creative way to remember how duloxetine works, using a mnemonic I like to call DULOX Express, dual tracks for mood and pain. Imagine duloxetine as a train running on two separate tracks. One track is for serotonin, which helps elevate mood, and the other is for norepinephrine, which plays a key role in pain control. This visual helps us understand how duloxetine can target both mood disorders and certain types of pain simultaneously. It's important to remember, though, that we should avoid using duloxetine in patients with damaged liver tissue, since the liver is crucial for processing this medication. Additionally, never pair duloxetine with MAO inhibitors, because that can lead to a dangerous overload of serotonin, risking serotonin syndrome. So keep this dual-track image in mind. That's the essence of how duloxetine functions and how to use it safely. let's wrap up with some important notes on exams and clinical practice. When it comes to exams, a common scenario is testing patients who have both depression and neuropathic pain. So, it's key to recognize how these two conditions often go hand in hand in clinical assessments. In practical, real-world settings, this medication can serve a dual purpose. It acts as a single agent that bridges mood stabilization and pain relief. This means it can help manage depressive symptoms while also alleviating neuropathic pain, which is quite valuable in complex cases. Overall, understanding these dual roles helps us better tailor our treatment plans and prepares us for both exam questions and real patient care.